for those people who are discouraged by the idea of wearing some type of hearing aid that is very perceptible by everybody,
You don't have
You don't have to do that
feel
anymore.
that way.
And it's the same thing with hearing aids for hearing loss and hearing aids for tinnitus. We have incredibly small custom-made products. And these are so important to know about because most of the time when people think of hearing aids, they think about what we refer to as the big beige banana. Right?
Oh, yeah.
I know
Nobody
what
wa-
you're talking about.
Yeah,
It's
nobody
like that.
wants to wear
Well,
those.
but think about hearing aids have come so far
They
is
have.
my
Yeah.
point.
They
And
have.
like, now they're tiny little things.
Right,
It's
and
amazing.
the tiny little ones can be remarkably effective. Those are the ones that I wear, and most people would never see them at all. And they make your life so much easier because they do help to manage tinnitus. They certainly manage hearing loss, and most of the time they're not visible.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right, we're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Today's topic is so important. We are talking about hearing loss, and hearing loss prevention.
Yes, being able to protect your ears and protect your hearing for as long as possible. What can you do? And you know who's going to fill us in on exactly how to protect our ears and tell us about hearing? Our expert today is Dr. Douglas Beck, who has more than 40 years of experience in the field as an audiologist. I can't wait to bring him in and talk to him.
Me too.
So we are joined now by Dr. Douglas Beck, who is an audiologist. You got your audiology degree, you have a doctorate, in audiology from the University of Florida and have more than 40 years of experience in the field?
Yeah, when I first started over 40 years ago, the standard degree to become an audiologist was a master's, and that changed about 25 years ago. So a lot of us who were practicing with a master's degree went back to get a doctorate. So I went to the University of Florida.
Wow. What made you want to pursue a degree in audiology in the first place?
When I was much younger, I was very interested in sound. I was very interested in music. I still am, but I wanted to find a profession where I could maximize my knowledge, my talent, my interest in sound, and it turned out to be audiology. But it was mostly dumb luck. I mean, when I was, of that age, when I started undergraduate, I'd never heard of audiology.
Oh, wow. What drew you to the field?
I happened to be at an incredible university, State University of New York in Buffalo. And one of the most famous audiologists in the history of the world happened to be there. His name is Dr. Jack Katz. I didn't seek him out. I just happened to land where he was. And after speaking with him for an hour or two as an undergraduate, I was so interested in what he had to say and what he was researching. Back in those days, we had what was called a dichotic hearing test. So you'd have some sounds in this ear, some sounds in this ear, and you would have to repeat back what you heard. And there were patterns that were very consistent with people who would have brainstem disorders. They might have an acoustic neuroma, which is a benign tumor in your cerebellopontine angle. And then there were other people who would have other patterns that were consistent with different diagnoses. So I was amazed at the ability of Dr. Katz and the tests that he created. One very famous one was the SSW, called the Staggered Spondaic Word Test. And that was the one where you had sounds here, and the patient would repeat back what they heard. The pattern that they would report gave you information about what was going on inside their brain.
And you found that fascinating and wanted to jump right on in there.
I found that to be pretty fascinating, and I've never looked back. Since I started in audiology, every year it's become more and more fascinating, and we impact more and more people's lives every year. So I'm delighted to play a small role.
And it seems to be such a changing field, right? Like the science is constantly changing.
The science
So
changes
interesting.
all the time. That's the definition of science. Science evolves. If the science is static, it's not science.
Right. Makes sense.
So the thing about audiology is most people think of it as hearing and hearing aids, and that's a big part of it, of course. But it's also hearing loss, it's also tinnitus, it's also balance problems, it's hearing aids, it's cochlear implants, it's brainstem implants. Audiology changes every year, and it keeps becoming more and more sophisticated.
Wow.
I can understand how that would be fascinating.
Yeah.
It's not the same. It's not saying the same year after year.
Keeps
Right.
And you're continuing to learn as well.
Oh, absolutely. I'm very fortunate. You know, I've always been in very, very exciting places where audiology is practiced and researched, and it infinitely helps patients with their satisfaction of life, their quality of life, their ability to understand speech and noise, their ability to hear. So it just keeps getting better.
So you, in your eyes, you would say that someone's ability to hear clearly, to hear well, has a direct impact on their quality of life. How is that?
Oh, absolutely. So in the USA, we have about 335 million people. And of those, about 38 to 40 million will have hearing loss on a hearing test. So then, and we call that an audiogram, is the paper that we plot that on, X's and O's, press the button when you hear the beep. So about 38 to 40 million people will have hearing loss on that. But there's another 26 million in the USA who have no hearing loss whatsoever, but they cannot understand speech and noise, or they'll report hearing difficulty, or they won't know what somebody just said. So the fact that you have hearing loss, never a good thing to have, but you can have difficulties hearing and listening even with normal hearing. And that's very common. 26 million Americans, no hearing loss, but they have difficulty listening. So I should clarify, hearing is simply perceiving or detecting sound. The human ear hears between about 20 hertz and 20,000 hertz. Most animals hear much better than we do. You know, your dogs or cats can hear
Dogs, yeah,
40,000, 50,000 hertz. Whales can hear out to, some of them, porpoises, dolphins, might hear 100,000, 140,000 hertz. You and I can't hear any of those sounds.
Right.
So when we talk about hearing, that's perceiving or detecting. But listening is unique to humans. You could say that, well, your dog can understand sit, stay, come. I would argue that most of them are responding to the tone, to the gesture. I raised German Shepherds for a long time, and they're very, very smart dogs. But I could say to my German Shepherd, couch, and they're going to sit, you know, because you do the inflection, you have the tone of voice. And,
Sure.
but you know, animals, and certainly there are some apes who've been able to understand and, you know, not just hear, but listen. Robin Williams did an incredible video with an ape, and this particular, I believe it was a gorilla, was able to converse and laugh with him. I mean, they would
That's
say,
right.
Wow. I remember
saw
that video.
Right?
Carrots. This
Right.
maybe explain too why my husband can't hear me.
Oh, here
Because
she
that-
goes. Here she goes.
I'm not going there.
Dr. Beck,
I'm
finish
not
this.
going
You're
there.
hilarious.
So if you YouTube that Robin Williams, gorilla, you'll see that. And so there are animals that are very, very exceptional from their own species. That one ape was absolutely incredible. But most animals, you know, they respond to screeches and barks and growls and warning signs, not really language. You and I can speak about, you know, science and math and politics and music and oceans and atmosphere and temperature. And we can have all these bizarre ideas. We can talk about space travel. We're the only beings that can do that. You know, language is a relatively unique human experience. So why do I mention this? Well, hearing is just perceiving or detecting sound, 20 hertz to 20,000 hertz. That's it. Listening is the ability to comprehend sound, to assign meaning to sound. Listening is the ability to hear and then run that sound through your brain for it to take on meaning. And so this becomes a big area in audiology, also attributed primarily to Dr. Jack Katz, auditory processing disorders. So many children, many adults have APD.
Yes, I'm telling you.
Yeah, and the best definition of that is the one that I think Jack Katz told me in 1976, 77. The question, of course, what is auditory processing disorders? And Jack said, it is what you do with what you hear. So it's not just how well you hear, it's how does your brain process that sound?
brain
How do you assign
yeah.
meaning to that? And many people are just terrible at auditory processing because they might have absolutely normal hearing, but their brain's ability to use that information maximally might have some impediments along the way.
Wow.
Is auditory processing disorder something that is impacted by hearing loss?
It can be. One of the theories of auditory processing disorders is that they're more prominent in people who have fluctuating hearing loss, middle ear disorders, otitis media that's not treated or not treated effectively, because the brain, as the child is developing, doesn't get a consistent sound from which it can associate meaning. So as the hearing loss fluctuates, the ability of the brain to make sense of the sound fluctuates, and many people think that that might lead to auditory processing disorders.
So, what are some of the causes of hearing loss, though? I know that as you get older, obviously that's a cause, but what are
Sure.
some other, as you mentioned, some children or.
Well, the number one and two causes of hearing loss are aging and noise. So when we talk about noise-induced hearing loss, that could be loud sounds from a factory, industrial, military, entertainment, and all of these things add up. The Occupational Safety and Health Administration, OSHA, says that you can listen to 90 decibels of sound. That's like me yelling in your ear from about 6 inches away. So very, very loud. You can listen to that for 8 hours, and longer than that, it'll cause hearing loss. But there's a time and loudness trade-off. So what happens, you can listen for 8 hours at 90 dB. You can listen for 4 hours at 95 dB, 2 hours at 100 dB, 1 hour at 105, 30 minutes at 110. Now keep in mind, at 30 minutes at 110 dB, you're causing hearing loss. So when you go to concerts, whether it's a rock concert or a symphony, and the sound around you is 100, 110, 120 decibels, oftentimes you'll go home and your ears are ringing. Sometimes your ears are full. They just feel like they're damped. You can't hear well. Well, a lot of times that'll go away. That's called a temporary threshold shift, but sometimes it won't, and it becomes a permanent threshold shift. So the best thing is you want to protect your hearing, protect your ears as best you can, because your ears have to last your whole life. And once you have permanent hearing loss, or aging-related hearing loss, or noise-induced hearing loss, that doesn't get better. There's nothing we can do to make that better other than, strategies with sophisticated hearing aids and other assistive listening devices. We have things like telecoils, we have loop systems, we have all sorts of devices that you can wear in your hearing aids or sometimes exterior to the hearing aids that make sounds louder. But they don't really impact your ability to listen unless they improve the signal-to-noise ratio.
When you're experiencing hearing loss, what is actually happening inside of your body?
So the most typical hearing losses, again, are the age-related hearing loss, which is
Right.
also called presbycusis, and noise-induced hearing loss. Where those are impacting your ear is on the inner ear. You have outer hair cells and inner hair cells, and they have nothing to do with the hair on your head.
Okay.
Outer hair cells and inner hair cells are neural transmitters.
Okay.
They just have the worst name ever in science. So most hearing loss is due to outer hair cells being destroyed from age, from ototoxic drugs, from noise. When you get an inner hair cell loss, that is a matter of neural synchrony. In other words, an inner hair cell loss, no matter how loud we make the sound, it's not going to be clear. So you have two things. You have some people need things louder. That would be most people with lesser degrees of hearing loss. And you have people who need things clearer. As your hearing loss progresses from an outer hair cell loss to an inner hair cell loss, more of the neural synchrony is sacrificed. And so even though we can make things louder, it may not be clear. However, this is 2024, and now we have amazing hearing aids that we can focus on speech sounds to improve the signal-to-noise ratio, and that does make it clearer for many people.
I want to go back really quickly to the hearing loss causes. You mentioned the two most common being aging and noise exposure.
Yes.
In my research, I also see genetic factors.
Sure.
Ototoxic medications,
Ototoxic.
ototoxic
Yeah.
medications, yeah, and infections and diseases. Can you talk about those, please?
Yeah, so hearing loss can be caused by a variety of signs and symptoms. When we talk about things that are most common, you have ototoxic drugs, which all physicians are aware of what those are. So it's always good to ask your doctor, if you have hearing loss, is this an ototoxic drug that you're prescribing? And if the answer is yes, the next question should be, is there something else I could use because I have hearing loss?
What is it?
Yeah, I was going to say, what's an example of an ototoxic medication?
Well, there are some antibiotics, particularly old school antibiotics, and many of the drugs that are used in oncology can be ototoxic. There are different platinum drugs, things like that.
Sure.
And so, our primary concern is most often saving the patient's life, right?
Absolutely.
And giving them a quality of life. But some of those drugs can cause damage to the inner ear, and that's usually irreversible. Aspirin can cause ototoxic
Wow.
effects in large dose, not taking
okay.
1 or 2 aspirin. But people who have to take more than 8 or 10 a day, it's good to talk to your doctor and say, hey, I'm really concerned about hearing loss. And aspirin can also cause tinnitus, ringing in the ears.
Okay.
Okay.
So those are ototoxic effects. If the drugs you're on are causing hearing loss or tinnitus, that would be ototoxic.
And there could also be genetic factors
Yeah,
that can impact hearing loss as well.
one of the major viral problems that we have in the USA is cytomegalovirus, CMV. So you'll have children now, about 99% of all children born in birthing centers, not born at home, but in a hospital or another type of birthing center, they are at the moment of birth, they're going to get a hearing screening. We can do that with otoacoustic emissions and with auditory brainstem response. What that means, we put a sound in the ear and we watch how the brain responds to it. We do it with 3 or more little stick-on electrodes. It doesn't hurt the baby at all, but it tells us, yes, that response is normal or it's abnormal. If it's abnormal, then obviously the child needs to be seen again in the next few weeks, repeat the test, and if the child has hearing loss, which is between 5 and 10 children out of 1,000, we want to know about that right away so that we can start habilitation for that child, whether it's hearing aids or if they are deaf at birth, then by age 9 months, we talk about cochlear implants. And it's very important that we don't let this wait until the child is 2 or 3 years old, because most of their language development will occur prior to age 36 months.
Right. Going back to the inner ear
Yeah.
stuff, is that related somehow to vertigo?
Yes.
Okay.
Oh, really? How so?
Yeah, so the inner ear is composed of the cochlea, which most of us know about. That's where sound is perceived and pushed along to the auditory nerve. But then you also have the vestibular system there, the labyrinth. So you have 3 little semicircular canals, and that's the essence between the semicircular canals and the endolymphatic sac, which is also part of the inner ear. That's where we get things like endolymphatic hydrops, Meniere's disease, and other variations of those. So the inner ear is hearing, but it's also balance. Most audiologists are therefore experts in balance as well as hearing and tinnitus.
Wow. Okay. And there's nothing you can do to prevent that, or?
Well, the most common balance disorder that we see, you can not necessarily prevent it, but you can manage it very, very well. It's called BPPV, benign positional paroxysmal vertigo. That's why everybody says BPPV.
Oh.
So what that means is within your inner ear, there are little crystal-like
Crystals.
things.
My
yes,
husband has major vertigo, so
yeah,
that's why.
and they migrate out depending on your
Yes.
head motions and things, and then you get terrifically dizzy. And when you see an otolaryngologist or an otologist, a neurotologist, or an audiologist, most of us do head repositioning maneuvers, and within minutes, the problem is solved. Repositioning maneuvers are probably 90-95% successful in managing BPPV as long as the diagnosis was correct. Sometimes, sometimes something will parade as BPPV. They'll go get what's called an Epley maneuver or similar repositioning maneuvers, and they don't work. And my gut feeling is that most often it wasn't BPPV to begin with.
Oh, okay. Interesting.
Hasn't even seen him, and he knows.
I know, right?
He's our expert.
Gotta
I
pass
mean, he
this on.
knows. He knows. I want to talk about tinnitus.
Sure.
Which,
Yes.
when we talk about it, whenever I see this word, I'm always like, oh, tinnitus.
Tinnitus.
And
I
I
thought
know
that
people
too.
who are watching and listening are like, oh, it's not tinnitus.
Is it the ringing of in the ears? Is
Yeah,
that
well,
what
it can be ringing.
Okay.
So tinnitus is very common. In America, we have about 50 to 55 million people with tinnitus.
Wow.
Very few of them are actually tinnitus patients. To become a tinnitus patient means that you are almost disabled or driven to distraction by your tinnitus. And for some people, it's a huge problem. They can't sleep well at night. They can't converse. They can't focus. It interrupts every bit of their day. There are no cures for tinnitus, but there are many ways to manage it. Even patients who are tinnitus patients, about 90% of them can be effectively managed. Now, some people immediately say, oh, if I can't cure it, I don't want to know about it. Well, we can't cure diabetes, but we can manage it. We can't cure many cancers, but we can manage them. So managing something 90% is pretty impressive.
Pretty good.
And I would urge people who have tinnitus that's problematic for them to seek professional help. Same thing with hearing and hearing loss and hearing aids. Best thing you can do, diagnosis first, treatment second. And some people want to skip that. They just want to go to the treatment. Well, good luck. I hope it works out. But I can almost guarantee that if you have a proper diagnosis from a licensed healthcare professional and then you treat that diagnosis, that's going to work out.
What are some of the strategies and management techniques that someone who has tinnitus and who has seen
Yeah.
a professional
Yeah.
and then received a diagnosis, what would they tell them they should do?
Well, the first thing is to look at that diagnosis, because if it looks suspicious, like it could be ear disease, like it could be a brain tumor, like it could be a much more dangerous issue, we want to diagnose that and treat it as quickly as possible. Most tinnitus is not dangerous, is not something that needs medical or surgical care. Most of it is not, probably 95% is not. And what we do for most of those patients is first of all, reassurance is very important, right? That you're not sick, you don't have a problem that's going to kill you or make you worse. You have a problem that is very common. I published a paper about 10 years ago saying that 80% of people with tinnitus have hearing loss, but they don't know it. And 80% of people with hearing loss have tinnitus.
Right.
The thing is that most tinnitus patients, you can't perceive what you don't hear. So they're aware of their tinnitus, and so they seek help for that. But step one is always a comprehensive audiometric evaluation. Go through the entire battery. Let's see what that reveals. Because quite often, it'll show hearing loss about 80% of the time on a tinnitus patient. And then we can treat the hearing loss, which most often will also treat the tinnitus. So hearing aids are probably our strongest tool for treating tinnitus. And some people say, oh, I don't want to wear hearing aids because I don't want them to show. Well, it wouldn't surprise some of you to know that most hearing aids now are larger, but there are certainly custom products about that big that fit deep inside your ear canal that you can't even see.
But what you're saying is, for those people who are discouraged by the idea of wearing some type of hearing aid that is very perceptible by everybody,
You don't have
You
you don't
do
have
that
to feel
anymore.
that way.
And it's the same thing with hearing aids for hearing loss and hearing aids for tinnitus. We have incredibly small custom-made products. And these are so important to know about because most of the time when people think of hearing aids, they think about what we refer to as the big beige banana. Right?
Oh, yeah.
I know what
Nobody
you're talking about.
Yeah,
It's
nobody
like
wants to wear those.
Well, but think about it. Hearing aids have come so far,
They
is
have.
my
Yeah.
point.
They
And
have.
that now they're tiny little things.
Right,
It's
and
amazing.
the tiny little ones can be remarkably effective. Those are the ones that I wear, and most people would never see them at all. And they make your life so much easier because they do help to manage tinnitus. They certainly manage hearing loss, and most of the time they're not visible. So this is another thing about, over the counter may be fine for some people, no issue, but you have to understand that there is a very real stigma associated with hearing aids. Now, I'm a hearing doctor, and I say that, and many of my colleagues say, oh, you shouldn't say that. Well, but it's reality. As a matter of fact, you can go to WebMD 2024, and you'll see they say it as well. There are a lot of peer-reviewed papers that say hearing aids are associated with the stigma because it does, in general, make people look less competent. It does, in general, make them look older.
Yeah.
I'm not saying they should, I'm saying they kind of do. That's what the literature shows us.
There's a stigma still associated with wearing a hearing aid?
Yeah, the hearing aid stigma has not gone away.
I can't believe
But
that.
now that they're so small.
Now,
Yeah.
well, the custom-made ones are small. You can't
Okay.
generally buy them over the counter. You can't generally buy them from big box. You have to see a licensed hearing care professional. Each state licenses these people, just like physicians or dentists or any other healthcare professional. And so they each have state laws and they have rules and regs that they have to follow. But when you go to see a licensed hearing care professional, whether it's an audiologist, a hearing instrument specialist, they can, given the specifics of your situation, make hearing aids, that are tiny, tiny, tiny. They have to take what's called a deep canal impression. They go almost to your eardrum. But they do it with incredible magnification. We have something called a video otoscope. So you can see exactly where the eardrum is. You place a piece of cotton there or other cushioning materials, and then you put sort of a silicone material in your ear, like getting a dental impression made. And we let that harden for 8 or 10 minutes. We take that out, and then the hearing aid is made from that cast. So then we can make it specific to your ear canal. And as we use smaller and smaller hearing aids, the beautiful thing is you need less and less power or less and less gain. Because if the hearing aid is out here, it has to overcome the distance and the volume of your ear canal. which is about 1 inch. But if you go smaller, 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 the distance between the hearing aid and the eardrum decreases, so you need less power to stimulate the eardrum.
Does that hurt?
Seriously, when a hearing care professional does this using a video otoscope and using modern 2024 equipment and techniques, it's pain-free.
Okay, that's good to know.
Yeah,
That's
it
good
doesn't
to
hurt
know.
at all.
The irony of the stigma is that I feel when you do start having hearing loss and you don't do anything about it, then you really do seem older and
That part.
detached. Do you know what I mean?
Because you're no longer participating in life.
Yes.
You're missing out. And maybe you're lonelier because if you're more inclined to not be around people because you don't understand what
Yeah.
they're saying,
Exactly.
you become a bit more reclusive. And that is so sad.
That's a brilliant observation. There's a lot of research that shows untreated hearing loss tends to exacerbate cognitive decline.
Alzheimer's,
It doesn't do
dementia.
it tomorrow, it doesn't do it next year, but over decades, of people having hearing loss, exactly the reasons you talk about. Their anxiety increases, depression increases, social isolation increases. So they're getting less and less auditory stimulation. And so their brain is literally changing in response to having less and less sensory input.
Yeah.
So the statistics on this are by the time you're 65 years of age, 1 out of 3 Americans has hearing loss.
Wow.
By the time you're 75, 2 out of 3 Americans have hearing loss. And right now there's about 70 to 72 million people in the USA with hearing loss. Now that number comes from the Global Burden of Disease study that Ear and Hearing published in 2024. So that's 1 out of 5 Americans has hearing loss, but only about 10% of those people wear hearing aids.
Really?
The other 90% are getting through their day and suffering with it. And when it causes enough pain, then they start to do something about it. And pain, I mean social isolation,
Emotional.
anxiety,
Yeah.
depression,
Yeah.
bad for your relationships, your
Yeah.
friends and family. Nobody wants to repeat it 4 times.
Yeah, and your
Exactly.
overall well-being. So we've talked so much about hearing aids and hearing loss. How can we prevent hearing loss, Dr. Beck? Let's start talking about that. Like, what protection can we provide to ourselves to ensure that our hearing and ability to listen
Yeah.
continue to be as good as they can for as long as it can be?
Well, there's a couple of things that we know, and there's probably a lot we don't know. To protect your hearing is most often a matter of protecting your hearing against long exposures to loud sounds. Even veterans who come back from battles who have normal hearing at that moment will complain often about speech and noise disorders, or they can't tell what people are saying. And we know that when we look deeper, when we do a comprehensive audiometric evaluation, we'll see asymmetries in the very high frequencies. Those aren't even tested in normal screenings. In fact, I think the most important thing you can do is make sure that the loudness of anything you're listening to, whether it's a concert, whether it's a chainsaw, if you can have a normal conversation and you can hear people around you, it's probably not too loud.
Okay.
If you can't hear them, it's probably too loud.
Oh, that's easy.
And hearing protection is pretty cheap, right? You can go to any major pharmacy, buy those little plugs, little
Earplugs.
foamy dudes, and but,
Foamy dudes.
Yeah, but people
They should call them that.
They should call them foamy dudes. And the problem is, most people don't use them correctly. They'll take them, they'll squeeze them, they'll put them in their ear, and you might as well not do it. So if you're going to do it correctly, you have to take those little foamy dudes, and you squeeze them. You roll them up
twist
really
them?
tiny. Yeah, you
Yeah.
roll
Really,
them
really tiny.
Yeah.
You stick it in your ear canal, and you hold your finger there while it's expanding. And if you're doing it properly,
Yeah.
all the sounds should go down. It should be attenuated as the foamy plug, because the foamy plugs can give you 15 or 20 dB of attenuation, which is plenty.
Okay. Well, what's
But-
great now too is the iPhone will show you the decibel of your environment.
It will, and
Right?
and you can download for free a sound level meter at the Play Store or at the App Store, and actually measure the sound around you. I'll tell you, I fly a lot, and in planes, once you're up at altitude 30, 35, 40,000 feet, frequently inside the cabin, you're talking about 85, 90 dB
Really?
of sound. It's very, very loud. And, when I drove Harleys for 50 years, everybody thinks they're super loud, and they are.
Yeah.
But they're not that loud for the person driving it, because the sound is going that way, right?
Interesting.
So it's coming out of the exhaust pipes, but you're going this way.
Okay.
So the sound, if you wear a helmet and hearing protection, you'll be fine.
Okay.
But it's not the driver that it bothers so much. And in fact, many of the drivers really like the low rumble, right? But I would say that the more damaging sound is for the people around you.
Oh.
2 things. I always wear noise canceling headphones,
Yeah.
over ear noise
Sure.
canceling headphones when I'm on an airplane. How important is it, if you can, and it don't have to be like top of the line,
Yeah.
to wear over the ear or maybe any type of
Yeah, I
noise
actually-
canceling headphones?
Yeah, so the over-the-ear are usually the best because you
Okay.
have a large cushion and it fits over it and
Okay,
seals it.
sure.
Right? Because when people get in the ear noise reduction units, sometimes they don't fit properly, so the noise is coming in anyway. So the cushions are a good way to go. And they often can give you 18, 20, 22 decibels of what's called NRR, noise reduction ratio. And that's very, very important because when you cut down sounds by 15 or 20 dB, even loud sounds at concerts, chainsaws, things like that, you go from being exposed for 30 minutes before you cause damage to now you can go 4 hours. You know, it depends on the numbers, but 15 or 20 dB of attenuation makes a huge difference.
And especially for kids, I would assume. I always put them on my kids on planes and
Yeah,
stuff.
Yeah.
well, that's a good thing, and I would urge that, you know, when they're watching movies and stuff like that, as long as you can say something to them and they can hear you, they're fine.
Oh, like at the movie theater. I never thought about that.
Yeah, well, movie theaters are always way too loud.
Yeah.
People love that sound. It's a psychological thing about movie theaters, particularly if you're
Right.
going to Star Wars or any of those.
It's fully it's full
Yeah.
immersion.
Full immersion, yeah.
Yeah.
But it's like being fully immersed in a lake. You don't
Right.
want
You
to.
don't wanna do that.
Okay.
You still need to breathe.
Yeah.
You said something earlier that I wanted to tie back into to this conversation, and it was about your love for music, your
Yeah.
passion for music, okay? And I always think about musicians, not just when I'm going to a concert,
Right.
but like Beyonce's Renaissance tour. I
Sure.
had the opportunity to go, and it was incredible.
Right.
But she had been doing that. How about Taylor Swift and the
Absolutely.
Eras tour?
Absolutely.
How
do they do
you as a musician
Yeah.
and people like Beyonce and Taylor Swift, how are they protecting their
Yeah,
ears?
good question.
Well, that's a great question. And we use different techniques for musicians. First of all, if you're a musician, and I am, if your hearing goes south, you're in trouble.
Yeah.
You know, you've lost the major tool that provides you with an income and provides you with social and entertainment and all of those things. So you have to protect your hearing. People on major concert tours can do this really well because they'll have audiologists who are trained with in-ear monitors. And so what we do is we always start with a basic comprehensive audiometric evaluation. Let's find out what their auditory ability is to begin with. Then you can put in-ear monitors, which are custom made. We do that with an ear mold. We take a custom impression. We put them on stage with their band or their group, whatever it is, and we measure the amount of sound coming through. So then the mix that they're hearing in their ear, the technician who is running the board can turn that up or down. They might, if you're a vocalist, you might want to hear your voice louder than everything else on
Right.
stage because you want to make sure that you're hitting the note properly.
That makes sense.
Yeah, and guitarists, particularly lead guitarists, they will.
Wait a minute, you're smiling. Is that you? For those who are not watching and just listening, are you a lead guitarist, Dr.
Sometimes,
Beck? Sometimes. Okay,
So,
go on. What do you do?
You know, they'll crank
After
it up so
hours.
that they don't hear anything else in the band except, you know, what they're doing. And
Right.
that's okay. I mean, I get that, but it can certainly cause hearing loss. And so the point about in-ear monitors is it's got to be controlled. You know, you should not do this without a professional hearing care provider setting the levels for you the first time so you know. Because when you put on in-ear monitors, it's very hard to know how loud you're speaking
Right.
and how loud you're playing.
Is it canceling out a lot
Some of
the...
them have noise cancellation, so
Okay.
that it just is giving you what you intend to go through the system.
Okay.
And when you do that, again, you can focus on your instrument. People who it's really, really successful and useful for, you know, you can see Elton John wears them, Paul McCartney
Yeah.
wears them, Michael Jackson used to wear them, and, you know, hundreds of thousands of performers today wear them. My biggest concern with in-ear monitors is the garage bands who are just buying an over-the-counter in-ear monitor, slapping it on, cranking it up. We refer to them as patients.
Oh, yeah. Well, I was gonna say
Ba-dum-bum.
I had worn them for musical theaters, but exactly what you just said. I felt like they were almost louder,
Yeah.
like it was too much in my ear.
Sure.
Yeah,
So
and-
damaging me.
and you can measure these things. We have tiny little microphones. It's called real ear measures. And we can put them almost against your eardrum. And then we could put a hearing aid in there. We could put an in-ear monitor. We could do almost anything. And we can measure how much sound is being delivered to your eardrum.
Wow. So,
So-
you're protecting them at the same time as
Oh,
it's a
yeah,
monitor.
that's
really,
the whole goal.
That's the whole
right?
point.
So
Okay.
they can hear selectively what they need to hear, but they can do it at a loudness level that is non-injurious.
Oh, wow.
Okay, we have this segment, Dr. Beck, and it's called Ask the Expert.
Sure.
This is an opportunity for people who are watching the show or listening to Care Experts to ask you,
Okay.
our expert, a question
Sure.
anonymously. I'm going to ask this first one. Are there any over-the-counter hearing protection devices that you recommend, or is it always best to get custom-fitted ones?
Well, honestly, custom fitted is always better. The over-the-counter hearing protection devices are okay. They're useful. They help a lot of people a lot of the time. But musicians have a product that's called musicians earplugs, and they're designed specifically for musicians. And what they do, they have a little island of hearing around 2, 3, 4,000 hertz, which is very, very good for conversational speech. But they roll off the highs and the lows. So the bass, the drums, the hi-hat, the other cymbals, those are rolled off. So they are decreased substantially. Could be 8, 15, 25 decibels, but you could still converse. Now, the sounds are a little bit unusual. You're not used to hearing less than a full complement of sound, but these products are very, very useful for musicians and for others who need to be in noise but still need to converse. Maitre d's at very noisy restaurants might use musicians' earplugs. It's going to change the tone, but it's going to allow you to converse without damaging your hearing.
That makes sense. All right, this person wants to know, are there any natural or alternative remedies for preventing or treating hearing loss, or is professional intervention always necessary?
Professional intervention is always necessary. We've already discussed things you can do to prevent hearing loss, and it's mostly about not being in loud situations for a long period of time. Hearing loss does occur naturally with aging, can't really prevent that. So the best thing is always to take care of your hearing, and when things seem loud, get out. I carry, of course I do, those little foamy plugs, and those guys are very, very useful if all of a sudden you find yourself in a difficult situation. I know most people aren't going to carry that, but you could. You could put a pair in your purse or in your pocket. If you suspect you're going to be in noise, bring those with you. It's better to have them and not need them than need them and not have them. And it's the same thing with eye drops, with chapstick. You don't really need those all the time, but most of us carry that sort of thing because we don't know when we're going to need it.
Just in case.
Just in case, yeah.
We'll tell you all about that. That's so funny. Okay, here's a question. Can surfer's ear lead to long-term hearing loss? I've never heard of surfer's ear.
Yeah, surfer's ear.
Is that like swimmer's ear?
It's almost exactly the same thing.
Okay.
It's a infection of the outer and middle ear, and it happens more from lakes and rivers than oceans because it's got to do with bacteria and viruses and fungi that are in the water. And swimmer's ear can be the same sort of thing, and it's very, very dangerous to leave it untreated because it actually can change the shape of your ear canal. It can close up your ear canal. It's very, very painful. Back in the day, the ENT doctors used to use wicks. They were cotton wicks, and they'd drop antibiotic lotions onto that. So yeah, it can lead to hearing loss, permanent hearing loss if untreated, and it can cause all sorts of problems.
This next person says, I'm super sensitive to loud sounds and get scared easily, including when dogs are barking.
Yeah.
Is this an early sign or symptom of hearing loss?
It can be. It probably isn't. That's called hyperacusis, meaning that, again, that somebody is particularly sensitive to loud sounds. And there's a lot of people who just can't go into a room because it's too loud in there. And they know that it's really going to be bothersome. And some people describe physical pain as a result. So hyperacusis is something that audiologists manage every day. There's all sorts of techniques. And if audiology techniques don't work out for you, there's CBT, which is cognitive behavioral therapy.
Oh, yeah.
And that works quite well. But I never send people to a psychologist for CBT first because I always want to know first, do you have hearing loss? Do you have listening problems? Because that changes what we do. If you go and get CBT first for tinnitus or hearing loss or hyperacusis, if you get CBT first, you're never going to see an audiologist to get a diagnosis of your hearing and listening ability.
Now, I know perception is reality, and I feel that since becoming a mom, my perception of how I hear has changed. And oftentimes you will hear moms say, "That's too loud, that's too many sounds." Is that real? Like after a woman gives birth, I don't know if it's like a hypersensitivity to
Yeah.
sound. I didn't used to have that. And as a news anchor and as someone who was a sideline reporter
Yeah.
at major sporting events around the
Right.
world, I'm used
a
to
problem,
hearing,
yeah.
but my child
maybe
and
you
the
got
TV and
damaged.
no, I'm really wondering, is
the
that
sports.
something? That's my Ask the Expert question, so
No,
it's not
that's a great
anonymous, it's
question.
me.
Well,
not a-
women of childbearing ages, there are certain hearing problems that come into play after childbirth. One of the most common is called otosclerosis.
Oh.
And that is where, you know, the three bones in your middle ear. So you have the stapes, the malleus, the incus. So when the stapes ossifies a bit around the oval window, which is where it's supposed to move around, that causes hearing loss. I'm not saying you have otosclerosis, you probably don't. But we do know that women of childbearing years are more prone to otosclerosis than other people. The difference in sensitivity and in hearing tonal qualities, particularly, you know, if we're going to relate it to childbirth, you know, hormones are mysterious things. I mean, we know a lot about hormones, absolutely. But we probably don't know as much as we need to. And I think that certainly women after childbirth are going through, you know, very dramatic changes.
Yeah,
Big
makes
time.
sense.
Yeah, and it wouldn't surprise me at all if it were something that impacted their sensitivity or their perception of sound.
Thank you.
I have a-
I seriously feel validated right now because
Yeah.
I thought that it was just me and just us moms thinking that.
That we're overstimulated. Yeah.
That we're overstimulated
Yeah,
all
yeah.
the time.
That
Thank you
makes
for
sense.
that.
Yeah,
Thank
well,
you.
I have one personal question as well.
Go for it.
What about wax buildup? Does
Yeah.
that, because someone I'm married to,
Throwing this poor man under the bus.
he doesn't listen to this episode. He gets, you know, his ears cleaned out professionally because
Yeah.
there's so much buildup. Actually, my baby has a lot too.
Oh my gosh.
I know, it's weird. So does that lead to hearing loss or?
Untreated cerumen or earwax, if it's left to build up, it can actually block the entire ear canal and it can cause a conductive loss, right? Because sound can't get through it. But most people don't have to worry about that. You know, the ear is a self-cleaning thing.
That's what I've heard.
And earwax coming out means that it is irrigating and it is taking debris out of the ear canal and bringing it to the outer ear where you can simply wipe it away, or in a shower, you can use soap, shampoo, and water. I always tell people to stay away from cotton swabs.
Wow.
Cotton swabs cause more problems than you could imagine. And what happens is, you know, somebody will go and try to dry out their ear, and all of a sudden they touch their eardrum, which is very, very painful. And sometimes you can pierce the eardrum, and that can cause hearing loss, that can cause all kinds of tinnitus, that can cause dizziness, all sorts of things, some of which can be fixed, some of which can't be fixed. There certainly are people who've used cotton swabs that have permanent injuries as a result. And, you know, all of us think we can do it, right? But it's best not. The best way to dry your ear, you know, I would take an old T-shirt, put it on your finger, and just kind of as deep as
Okay.
you can go with your finger, you're probably fine.
Okay.
But cotton swabs go way
Or
too
go
deep.
to a professional like he did.
Yeah, I mean, a lot of people go to audiologists and otolaryngologists just to have their ears cleaned. Some people do develop a lot of earwax, and it's easier to just clean it every 6 months or every 12 months, whatever is appropriate for that person, so that they don't have to worry about it. And, you know, for some people, it is a significant problem, and they go into the office just to have that done on a regular basis. But for most people, it's not necessary.
Was there anything that we didn't ask you that you would like to share?
I think we covered a lot of the most important things, right? That hearing health is something you have to pay attention to. You're probably going to live to be 80 or older. Once your ears are damaged, we can't fix them. We can manage them. Untreated hearing loss in high-risk patients, these are people with comorbidities, maybe diabetes, maybe cardiovascular disease, people who have other issues going on, people of lower socioeconomic group, people of older age, people with more significant hearing loss. As these things build up, untreated hearing loss does tend to exacerbate cognitive decline. And, you know, it's very important that we think about this because right now In the USA, we probably have 8 to 10 million people diagnosed with dementia. Globally, right now, we have about 55 million. By 2050, it'll be 3 times that. It'll be 150, 160 million people with dementia. Not to say that all of them had hearing loss. We don't know that. What we do know is that in the studies that have been done, when you look at the ACHIEVE study out of Johns Hopkins, when you look at the ENHANCE study out of Australia, you'll see that people who treat their hearing loss, who have other issues going on, generally do better than people who don't treat their hearing loss. And I'm talking about with regard to word clarity, I'm talking about cognitive function, the aggressiveness. So untreated hearing loss in certain populations tends to exacerbate cognitive decline. When I say at-risk patients, certain populations, we're talking about people who are lower socioeconomic. They might have more hearing loss. They have comorbidities such as diabetes or cardiovascular disease. When those people have hearing loss that's untreated, they are in the group that's at a higher risk for cognitive decline. The fact that you have hearing loss and you're 27 years old and you have a PhD in electrical engineering, you're probably not at very substantial risk. But older people who have long-term hearing loss that's untreated, they get more and more into the at-risk population. Lots of studies have looked at this. The Johns Hopkins study came out of Baltimore last year, and they showed that about 47% decline in cognitive issues over 3 years by treating hearing loss. The study out of Australia by Dr. Sarah Bant and her colleagues, they looked at people who chose to get hearing aids and people who chose not to. Now, they were all older folks. They were at risk. But the people who got hearing aids, none of them declined any further. The people who chose not to get hearing aids did decline.
Amazing.
So there's a lot of very impressive studies like that. It's not a one-to-one correlation. It's certainly not that hearing loss causes dementia. But what happens is your brain undergoes lots and lots and lots of changes as hearing loss gets worse and worse in the presence of other signs and symptoms. And these things all combine to cause terrible problems.
So you want to prevent those, and you are such an academic. Like, I'm just sitting here
Yeah,
listening, and I
so
feel
fascinating.
it is so fascinating, and your ability to make it digestible and just approachable feels really good, and we are so appreciative of your expertise. Thank you so much,
thank
Dr.
you,
My
Beck,
pleasure. I
Beck.
for
appreciate
joining
you
us
having
and
me here.
breaking us all down.
Yeah.
Will you come back?
Absolutely.
We have more to talk about. Okay, great.
Yay.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.